Hey guys, happy Sunday morning or afternoon, wherever you're at, whenever you watched this. I haven't seen any questions in the comments. I guess we need to build up more of a following first, so then we'll get some people who will ask when they see what our channel is all about. But I did come across something really interesting yesterday, and so I took some notes because I found some of this really interesting. It was mostly about antidepressants, and antidepressant medications, there's all kinds of them. They use stuff that is off-label sometimes, but my disclaimer, I'm not a doctor, I'm not a psychiatrist, I am not a counselor. I've had anxiety for about 30 years, and so I have had a lot of experience with relapsing and, people changing my medicine just because they didn't want me to take that medicine because people who were addicted took it and they didn't want to get in trouble filling it for me. And I went through a lot of hell because of that, actually. And they ended up having to put me back on the medication anyway. But for those of us who are on antidepressants as well, because I am too, I was reading something from the WebMD, and I get that email. I can't remember if it's every day or a couple of times a week or something. And it usually talks about different things. Mine, of course, is mostly geared toward women. But they had an article in there about how the antidepressants work and stuff like that. So I thought I would pass on the information. So they started off that the antidepressants work by balancing the chemicals in your brain, which is called neurotransmitters, serotonin, norepinephrine, adrenaline, things like that, which, they're like hormones, chemicals. And you make them naturally, usually. And a regular doctor can prescribe that to you if you so need it. However, if you have bad depression, repeated depression, usually a doctor's going to send you to a psychiatrist or a counselor or something, mostly a psychiatrist first, to make sure that they can get the right type of medicine prescribed for you. Now, some doctors, after that happens, you don't really have to keep going back to the psychiatrist unless they prefer you to also have counseling, like group sessions, or even a meeting with just them once a month or once a week. It really depends on your how bad it is. But with the more severe symptoms, they usually end up where they will send you to a psychiatrist and let them do the prescription, because let's face it, nobody wants to get their butt in trouble no more. And people who have mental health, unfortunately, there is a lot of people who do have mental health, and they are also addicted because they started off trying to make themselves feel better. But this is stuff that I found out on my own. I always did a lot of reading and a lot of studying, because when I had a relapse where it was, really bad, I wanted to know all I could know about it. I thought there was something wrong with me. Obviously there was, but I mean, that medicine couldn't even heal. So I took, I think I told you guys, I took Paxil a couple of times. I took generic Prozac, which is fluoxetine, a couple of times, and they kept me on the fluoxetine. and I was on 20 milligrams. But I've had it. Now, I don't understand it because I'm on the very same dose of alprazolam that I've been on from the beginning, except when I had the relapse, they gave me more of it or something that I had to take for a few weeks. But then I went right back on my low dose, and it's still working. But I started having a lot more breakthrough panic attacks and stuff, and so they bumped up the alprazolam to 40 milligrams, and so far it's been okay, and it's been several years on that. So let's see what else we got here. I was going to ask you guys, whoever is watching this program, because you do have anxiety or depression or something like that, or somebody in your family does, what is or was your hesitation about going to a psychiatrist? Like, were you embarrassed that you had to go, or that people were going to think you were crazy, or what have you? I didn't have that problem. The reason I didn't is because my mom had schizophrenia and she wouldn't go, and it got worse and worse, and, well, long story. So, excuse me. So what I did is, when they sent me, I went a few times, and then the doctor just prescribed my medicine for a really long time. And I think the last time I went to see a psychiatrist was in 2006, I think so. I think it was 2006. But we have such a drug problem now that the doctors are scared to prescribe stuff, and that makes it bad for the people who really need it. The stuff that works, by the way. Okay, let's see here. Medications can and do help, and I agree with that, with depression. But it don't always treat the causes of depression. So that's why they like to make you go to counseling and stuff like that. Well, I went through counseling and all that, and that didn't make me feel any better. It probably made me feel worse because it was bringing it up, all over again. So, I don't know. But, everybody's an individual. Everybody's a different person. Everybody takes different medicines, It's a really, really confusing mental illness to me. Anxiety, panic, depression. Because I used to get depressed for no reason. I used to get panic attacks for no reason. I used to get anxiety for no reason. But they told me it was because years ago, when I was young and went through a lot of bad domestic violence, it didn't come out then. But it came out later on when my life was a lot better, which really surprised me. I think I told some of you this before. But anyway, most of the medications raise the brain's serotonin level. And most doctors feel that the meds are better with the therapy. That's what I said earlier. But I don't know. I have my questions on both of those. So, let's see. You know what my psychiatrist told me when I did go to him? I always was into meditation in some form, ever since I've been young. But he told me about meditation and told me to start doing it. I said, that's not going to work. I've tried the breathing and this and that. But he told me how to do it. And he told me, when you do it, you're going to sit by yourself in a room or on your porch, wherever you feel more, comfortable. And just breathe in your nose slowly, deep as you can go, and breathe out like you're exhaling a little bit more than you can. And you're not doing it hard. You're doing it slow too. So you go. Like you're breathing out to the last breath. You can't do it no more. And you do that for about 5 minutes. Some people visualize while they do it that they're in a special place that they really like or whatever. I did the visualization. I don't know if that worked or not, guys, to be honest. But after a few weeks, the meditation really did work because you're concentrating on your breathing. So it does work. But you have to give it a chance. And keep in mind, mine was working with meds. They were giving me medicine too. Everybody's different. Everybody is different. But you do have to speak up for yourself at the doctor. You don't have to be nasty, but you got to speak up for yourself. Explain to them, I know there's people out here that abuse these drugs, but this is what I've been taking and this is what works. Because I remember when I moved from Florida to Georgia, the doctor that was there, she was way different, to be honest. And I think she was a nurse practitioner, but she had been supposedly there for years. And when I went in to get refills of my medicine, even though I have all my records, to show her, she tried to give me something different to control my anxiety. And I was so scared because the only thing that worked for me was the alprazolam. And when I had the really bad breakdown, and so I did not want to try to change it, But she was like, really nasty now. She was like, well, I'm not going to jail or getting in trouble because of you, so you're going to have to take this. I didn't know what to say. I never had that happen before. So I went home, I tried to take it, and it helped a little bit, but it did not control it. And so I ended up finding a different doctor. And unfortunately, I don't like to play doctor shopping. I want to be with a doctor for the long haul so they know who I am, know the way I am, what have you. But I hate how they change everybody's medicine, especially people who are very depressed. I know nobody wants to be on medication. I don't even want to be on medication. I take diabetes medication and everything. Do I want to? No. But I have bad kidneys now, so that's what I take it for, believe it or not. So, that's what they give it to me for. But, cholesterol medicine I take. Yeah, I would prefer not to take anything but a damn aspirin when I need it. But if you get on something, if they insist, well, you try this first. In 3 or 4 weeks, if that ain't working, or you seem like you're getting worse way before that, you need to go to the emergency room. You need to call your doctor and say, look, this is not working. Don't be afraid to do that. People don't realize that you're the customer. When, the doctor is a doctor, yes, and they're supposed to care about you and care what you take and everything. But you still are the customer, and you need to either, negotiate with them and see what they can give you that's different or whatever. But if you are not absolutely feeling better, find somebody else. Find somebody else. And I know how hard it is, especially in a small town. Oh my God. They don't even have psychiatrists. You have to drive into the biggest town or, sometimes you're out of luck, And I don't think that's right. I just don't. They can't treat everybody like we're all drug addicts, you know. Yeah. You gotta remember, there is innocent people out there that are sick and need their medicine and need to take it correctly. Yes. But anyway, every day is precious of your life. Every day is precious. And once this minute that I'm talking goes away, it's gone forever. And that's the way every minute of your life is. So nobody deserves to sit there and have depression and anxiety or anything like that. Pain, for example. Because pain medicines is the same way, because that's what they do. You know, everybody took them to get themselves messed up, so now they're going to make everybody else suffer, and that's not right. And, you know, they were talking about that on the web MD. They were saying, you know, there's a shortage of doctors. And there is. There's a shortage of regular doctors, let alone psychiatrists, counselors, what have you. There is a shortage. Or there is people who don't have insurance. You know, it's a myriad of things. But I know a lot of people who would probably benefit from at least a monthly visit for a while, you know, with a psychiatrist. I think it would help some, you know, to get the depression at least under control and the anxiety. And doctors are overloaded, guys. They are overloaded with patients. I'm telling you. Some of my relatives in Illinois, I can't even believe this because I grew up in Illinois and it was like, go, you need an appointment? Call, you have one in 10 minutes or you get it in the morning. Not anymore. So we are having a shortage of doctors everywhere. Many of the doctors are doing Zoom visits now. And I don't know whether I agree with that or not. I think Zoom visits are pretty good as long as you meet your doctor first and, you know, your doctor gets to know you, whatever, and what's wrong with you, and they really take care of you, and they send you for the test, you know, if you need the test or whatever, for whatever. And then I think long-term Zoom meetings are great. As long as you go in every maybe 6 months or less and get your blood taken, be checked out, have a physical once a year. I think it's all right to do Zoom visits, and, you know, I'm sure other people do too. They don't want to go sit in the office. All right, I'm making sure I covered all that with you guys because I wanted to have my say too. One thing they were talking about on the WebMD newsletter was that people who start feeling better, they usually try to quit their medicine. They think, okay, I took it, I feel better now, and I don't need it anymore. That's not a good idea. At least it wasn't for me, because that's what I did. I said, man, I was in a new marriage. I didn't want my husband thinking I was some screwball or something and, you know, just wanting medicine. But, I don't know. I quit the medicine and I got very, very sick. I can tell you that. I would not quit again. I would not quit again. And I even got cussed out by an ER doctor. I remember it. I swear I do. I was brought to the hospital like 5 times in 1 month by an ambulance because I kept telling Bert, my husband, I'm going to have a heart attack. I feel it. My heart is pounding. I can't breathe. I just know something's wrong with me. We got to go, blah, blah, blah. So 5 times. On the 5th time, there was a lady doctor in the ER. And she got so mad at me. She said, I've seen you here before. She said, why don't you want to take your medicine? I said, because I don't want people thinking I'm a druggie. And I swear to you, that's what I said. And she said, well, we must have millions of druggies in the world then, because, which we do probably, but she said, because there's millions of people taking Prozac. There's millions of people taking these medications. You are no exception. And I don't want to see you here anymore. Take your medicine. I mean, she was really giving it to me. I didn't even give it back to her because when I know I'm wrong, and usually I stick up for myself really good, but, you know, she was right. She was right. I was letting society dictate to me what I should do. So don't do that. Let's see. We also, though, we have a bunch of people who take the medicine, and the medicine, they get no relief from it. Or they get very few, not get very few, they get very little relief from it. So that's, again, don't be ashamed or afraid to tell your provider, this crap is not working, okay? Because there's a whole bunch of medications out there. You know, I mean, that's like my son, he has epilepsy and it's uncontrollable. I mean, they have given him so many medications. They didn't even work. They didn't even work. And he still has seizures. And he used to have a really, really good job. Yeah, his life completely changed. It completely changed because he has grandma, and he just has them whenever. Don't matter where he is, what he's doing, he don't even know when they're coming. And, yeah. So, I mean, that's another, and you know what's funny about that? Is they're both illnesses of the brain. Is that weird or what? Well, at least they consider it. I mean, the brain releases those chemicals in depression and anxiety and panic or whatever that, you know, and you got to take medication, so I guess it won't release them, or it'll release a specific one more. So it's just uncanny that epilepsy is basically, it's different, but it's a brain illness, brain disease, you know. It's really weird, and weird that in some people medicines do not work. And yeah, let's see. But you have to think about it too. Why would you want to take medicines that don't work? You're putting chemicals in your body that could possibly damage your liver or your kidneys or what have you. And you're taking them thinking they're helping you, and then they don't do crap, you know. So, I mean, that's why I could never understand people who do drugs, because that stuff eats you alive eventually. Let's see. I think we about covered everything that was on that. They did say, though, and I found this interesting, because, you know, some of the tricyclic drugs and mental illness drugs, if you will, anxiety, panic, depression, what have you, it seems like they're having to go back to the older medicines, that the newer ones are not working on people. Or at least that's what I've been reading, is that the ones that they would give somebody a new medication or try a new case on that medication. It would work for a while and then it would stop, or it wouldn't work at all. So then they had to go back to the old medications. And they said those old medications were terrible for you. They did. I mean, that's like the hydrocodone pain pills or whatever. They said everybody's getting high off them suckers and we ain't giving them out no more, blah, blah, blah. You got to use this. So I ended up having some pain because I have a bad back and sciatica. And the doctor here, she said, well, we don't like the prescription for that, so you'll have to go to a pain clinic. Or she says, but let me give you something in the meantime. Now, here it is. Let me give you something in the meantime to help your pain until you get a clinic appointment, because you're going to need a referral, and this doctor's pain clinic is like a 3 month to 6 month wait. Okay? I was like, okay, whatever, just, because I can't take ibuprofen at all because of my kidneys. So anyway, you know what she gave me? Tylenol with codeine, number 3. Then she had to bump it up to number 4 because 3 wasn't working. Okay? Neither one did. But it worked enough that it took some of the edge off the pain. However, what I was laughing about was, when I remember this, because see, my ex-husband, when I was very, very young, he was into drugs, okay? And they took away, this is my opinion now, remember, they took away codeine, they took away Tylenol with codeine, 3, 4, I don't know how many they had, 5, 6, 7. But they took it away because people were getting high on it. Okay? All right. Now, people are getting high on all these codone things. So, they brought those back. That's the very first time I ever had anybody prescribe me Tylenol with codeine since I was about 25. And I'm 67. Okay? Because they said, oh, those things are bad for you. Just like they say now for the hydrocodone. So what do? I don't know. I don't know what the answer is, guys. I really don't. But there's got to be a happy medium somewhere. However, I just slipped that in there because I thought it was funny that now they're saying, oh, the older antidepressants and stuff are working better for some reason, or with some people, so we had to go back to them. I don't know. Let me make sure I covered all this. Let's see. Yeah, that's what it was. That's what I was going to tell you guys. I hope you guys will share me out. Talk to your friends. You guys, it doesn't have to be, it could be a life question you ask me. It doesn't have to be about anxiety, panic, and depression. I mean, because face it, we all have life to deal with. And I've lived probably, I probably lived a lot more than other people, guys. Not everybody, because I'm sure there's people out there like me. But, so the channel here is about life. It's about anxiety, depression, and panic attacks. From me. Only my opinion. Always go to your doctor and get his opinion, because that's important. If you guys are interested in the book I wrote, I believe I've been putting it in the description, but it's at Amazon, and I have an Amazon link as well, and if you guys go through it, I'm supposed to get a little pittance. I don't know if that works or not, because I never had anybody go through it, so, but I think they're selling the book for like $10 or something. But yeah, you read that book, especially if you only have a relative who has problems, because it will open your eyes, okay? But I love all you guys. Please give me a thumbs up. Got to get my channel going here. Please subscribe if you haven't subscribed already. We would love to have you. The more the merrier. Make sure you ring the bell next to subscribe so you will get the videos as I put them on. I'm trying to do it as often as I can. I was shooting for 3 times a week, but since we didn't get any questions yet, I'm kind of doing it as I can, like 2 to 3 times a week. But anyways, I love all you guys. Have a blessed day. Have a blessed week. Take care of each other. And we'll talk to you on the next one.